Hello everyone, I hope you're enjoying MICCAI 2024 so far. Clinicians look at rotating maximum intensity projections or MIPs of PET images all the time. And they convey lots of valuable information about the disease and the progression of the disease doing that. So why shouldn't AI also do that? Especially because of existing state-of-the-art 2D AI techniques that can be brought to the field. Also, their potential to outperform typical deep learning techniques in medical imaging. So just as a little bit of background, prostate cancer is the second most prevalent cancer in men and fifth leading cause of cancer-related death. PSMA PET CT imaging modalities is an advanced molecular imaging for visualizing prostate cancer metastases. It's got some properties like higher sensitivity and specificity compared to the unconventional modalities like MRI or ultrasound. But there are still challenges facing the accurate detection and segmentation of such metastatic lesions. For example, low signal-to-noise ratio, heterogeneous sizes, and very high uptakes of normal organs like bladder or kidneys. For example, the performance of the segmentation methods on the same dataset that we worked on were really low so far. For example, using 2D method 0.38 was the best score metric, and using the 3D segmentation methods up to 0.47. So we proposed lesion segmentation method using 2D denoise diffusion probabilistic models, but on multi-angle maximum intensity projections or MIPs. So our proposed method has three main steps. The first step would be generating MIPs or multi-angle maximum intensity projections for every 5 degrees of rotation of the volume around the main axis, and computing 4 different type of MIPs. Then segmenting the PSMA prostate cancer lesions on these rotational MIPs using the denoise diffusion probabilistic model, and then back projecting the segmentation masks from the projection space to the original 3D space using the OSCM algorithm. All right, so the dataset that we have are comprised of 510 whole body PSMA PET CT images from the prostate cancer patients with biochemical recurrence of the disease after the initial therapy. So we did pre-process the images, and we compute 4 different types of PET MIPs. 3 of them are regular maximum intensity projections using different values for clipping the voxel intensities, and 1 depth MIP, which is similar to the disparity map in general computer vision. So our DDPM model takes 5 input channel as input as prior information for different types of MIPs, and also the segmentation mask, the ground truth segmentation mask. We train it for 150,000 iterations using the learning rate of 10 to the minus 4, using Atom Optimizer on a single GPU with 16 gigabytes of GPU memory. We tested our method on 50 patients using the ensemble of 10 segmentation masks, and reconstructed the segmentation mask from the projection space back to the volume space, 3D space, using OSCM algorithm with 40 iterations of 20 subsets, and we compared our result with the 8 state-of-the-art 3D segmentation methods. So in terms of 4 different segmentation metrics, which are Dice score, Hausdorff distance, Jacquard index, and volume percentage error, our MIP DDPM method outperforms all these 8 segmentation methods. And so in conclusion, we propose a novel method using denoise diffusion probabilistic models for segmenting the prostate cancer lesions. which is able to outperform the state-of-the-art 3D segmentation methods, and it's got potential advancement in small metastatic lesions identification in different imaging modalities. Thank you so much for your attention, and if you have any questions, comments, or thoughts, please reach out to me on this email. Thank you so much.